Good morning, everyone. My name is Dr. Karthik. I'm an ENT and a head and neck surgeon. Today, I'm going to talk about a topic which is nothing but a tongue ulcer. Ulcer is nothing but a irregular surface area which is not resolving with medications or a persistent or an excavated area which is causing trouble to the patient. Generally, when a patient has an ulcer which is persistent and not resolving with medications, or any lesion present in the tongue which is not resolving with conservative medicines, generally it has to be evaluated. More than 4 weeks of persistent ulcer, you have to have a strong suspicion for a pre-malignant lesion or a malignant lesion. Generally, there are a lot of pre-malignant lesions which can progress into a malignant lesion. Whenever such patients come to our setup, generally we have you need to evaluate strongly regarding a clinical examination. So you have to ask them history regarding whether there is any history of gutka chewing or a smoking or any alcohol consumption or very sharp tooth or a spicy food consumption, which is actually traumatizing the mucosa of the tongue. So whenever that patient comes over and you have to clinically examine it by palpation, by inspection, and if at all you find it suspicious, and then the next step of management is to confirm the diagnosis, you have to take a biopsy. We can decide on the next line of management. So the biopsy, it can either be a malignant or a non-malignant lesion. Non-malignant lesions, based on the report, you can actually do a excision of the lesion, or if at all it's a malignant, then you have to evaluate it further whether the tumor has spread to other areas or no. So based on that, CT scan or an MRI scan is recommended.